Hello. In this video, I want to address something that I hear that's very, very common in our office, and it's the whole concept, the whole idea of what is normal versus what is common. So many times when patients come into our office, they said, I get headaches on a daily basis, but that's normal. Or I get headaches every month with my cycle, but that's normal. I get neck pain, but that's normal. I get back pain, but that's normal. I have this digestive issue going on, but that's normal. I have allergies, that's normal. I have arthritis, but I'm just getting old, and that's a normal part of aging. So I just want you to understand that those things are not normal. Normal is for your body to develop healthy, vital, strong, and vibrant. What's common in our society, it's common for people to have headaches. It's common for people to have neck or back pain. It's common for people to take several different medications to cover up the symptoms of different things that they're experiencing. That's common. It's just not normal to do those things. It's common for people to have arthritis, but it's just not normal. And again, that's why we actually work with kids, because oftentimes if you work with kids, you can prevent or you can stop the problem at its earliest stages before it develops into nasty, full-blown bone spurs and arthritis and degeneration. But I'll give you one good example with arthritis. I have a patient who's 92 years old, actually recently passed away. When I x-rayed her spine, she had her alignment front to back, it was straight up and down, and she had perfect curves in her spine. Let me back up and tell you why she came in. She came in because her granddaughter and her daughter were both patients. They got such great results here in the office. They just wanted their mom, who's in her 90s, they wanted her mom just to get checked out to try to keep her as healthy as possible. So she came in, she didn't have a lot of symptoms. She was fully taking care of herself, a vibrant, healthy lady. And she didn't have arthritis or degeneration in her spine at 92 years old. Now again, the most common thing I hear is like arthritis is just a normal part of aging. But I ask you, is 92 years old, is that old? And I think we'd all agree that 92 years old is very old in our society, in our world. And she had no arthritis or degeneration in her spine. Now, on the flip side of that, the earliest I've seen bone spurs and arthritis is at the age of 12 and the age of 14. Now, these two kids, they actually one had a trauma where he was riding a four-wheeler and he didn't see an electric fence. He actually got clotheslined off and he got carried off the back of that four-wheeler. So there's a severe trauma. He's lucky it wasn't worse. He's lucky he didn't die from it, but there's a trauma to his spine where the curve in the neck, and there'll be another video to describe the proper curves and alignment, but the curve in the neck is supposed to go forward. If you have a good curve in your neck that goes forward, it's like a spring or a shock absorber, and it helps to protect your joints. That helps to whenever gravity compresses down, there's an even load in all of your joints where all of your joints are developing properly throughout your life, and it doesn't have a lot of stress on the spinal cord and on the nerves either. But for him, what he had happened, when he had that electric fence hit his neck, it actually reversed the curve in his neck, and it was starting to cause that area of his spine to collapse. And so what the body was doing to keep it from collapsing and to protect that damaged area from the trauma was it starting to put a lot of bone spurs and arthritis and degeneration at the age of 12 and the age of 14. So again, if you've had traumas to your spine, which most of us have fallen out of trees, most of us have fallen off our bikes, most of us have had motor vehicle accidents, a lot of people have motor vehicle accidents, sports injuries, or sitting for hours and hours with poor posture, all of those things can cause traumas to your spine that over time, if left alone, it can actually cause degeneration in your spine. And so the reason why we believe it's important for everyone to get checked is because we've had so many traumas in our bodies in our lifetime that if they are not checked and healed and taken care of properly, can cause a lot of serious problems down the road that we feel are normal. They're not normal, they're just common. So I hope that helps you understand the normal versus common. And here's what's really neat. Oftentimes we find when people start to address and make sure that they're getting their spine healthy and their nervous system healthy with chiropractic, with stretches and exercises and range of motion type exercises and stretches. And when they start working on their diet and start working with their mental attitude and their physical exercise and movement, a lot of problems that they thought were normal to them they go away, which is really amazing, and it's really awesome because your body is designed to heal, it's designed to function, not to fail, but we have to take care of it. We have to give it what it needs, and we have to take care of it. So hope that helps, and we'll see you in another video.